As previously reported here on Aliyah News, the Nefesh B'Nefesh organization held a MedX event in Teaneck, New Jersey earlier this month, drawing large numbers of Jewish people, especially medical professionals interested in making Aliyah. Nearly 400 doctors, nurses, pharmacists, lab technicians, dentists, and others took part in the event, taking steps that will make it easier upon their arrival in Israel. Representatives from all over Israel's large healthcare facilities and HMOs were on hand to recruit, network, answer questions, and otherwise assist in the process preparing for their Aliyah to Israel. Several participants said they'd managed to make serious progress in getting necessary paperwork sorted out for their Aliyah, as well as finding good prospects for employment and professional development in Israel. Tony Gelbart, co-founder and chairman of Nefesh B'Nefesh, says MedX is an integral part of our Aliyah vision. It's not enough to simply help Olim, immigrants, move to Israel. We have to make the journey streamlined as possible. And this paves the way for medical professionals across North America to cut through the bureaucracy in order to enable physicians and medical professionals to concentrate on building their professional and personal lives right here in Israel. The need for young medical professionals to make Aliyah is somewhat urgent, as the average age of people working in the most vital areas in the medical field in Israel is high, and the number of young Israelis needed to go to medical school and able to replace those it's getting stressful. We need more medical professionals now. Negev, Galilee, and National Resilience Minister Yitzhak Wasserloff says the goal to increase the number of medical personnel, specifically for the Negev and the Galilee region, is modern-day Zionism at work, and it will provide exactly what these communities need. This initiative also helps promote the quality of life and resilience in the periphery. That's far away from Tel Aviv, and Jerusalem, the areas that are periphery. It's one of their core issues. The MedX in New Jersey attracted interest from a number of Israeli government ministries, all of which have committed to assist the new immigrants in whatever way needed. Turning from medical professionals to another small but vitally important group which is trying to return to Israel now, make Aliyah, it's the Jewish community in India. There's 5 separate groupings there in India, each of which has a tradition of being descended from a different Jewish group of refugees who were carried away by the Assyrians years ago, thousands of years ago, in different epochs of history. The different groups include the Kohen Jews of Kerala, India, Baghdadi Jews of West Bengal, India, the Bnei Ephraim group of Andhra Pradesh, and the Bnei Manasseh Jews of Northeast India. Each group has its own unique tradition, speaks different dialects, different languages. Altogether, these different groups with roots in the subcontinent roughly number, 100,000. Several thousand Jewish people still live in India today, and many are interested in making Aliyah. There are great efforts being made to help them on their journey, and Israel's waiting to welcome them when they arrive. As always, the work is being done by private initiatives that play a vital role in this small but important wave of Aliyah, and get them their specialized needs so they can integrate and get attached here. It's very hard for the government bureaucracy to handle this and to manage this. What does all this mean? Every Jewish person who makes Aliyah to Israel has a cause for celebration, but the Aliyah of medical professionals is so special. These professionals bring with them the skills, the abilities needed to take care of others who are sick, injured, otherwise unable to take care of themselves. Every country needs such people. Israel's healthcare field is more vulnerable than most because of the number of young Israelis who choose to go to the medical school and into these professions has really dropped rapidly, and it's not enough to keep pace with the growing population here in Israel. That's why this MedX conference, put together by Nefesh B'Nefesh with the cooperation of a few number of private initiatives and the government of Israel, is fantastic. The private sector, the public sector is coming together to solve this problem, this need. The Aliyah Return Center is strategically posed in this nexus between the public and the private spheres. Although with close collaboration with different Ministry of Aliyah, Ministry of Absorption, different groups, a number of other actors in the Aliyah field, we're doing our part to be your hands and feet in the Holy Land, making a difference, giving the new immigrants a soft landing as they arrive in Israel, giving them the tools they need to launch a successful new life in the ancestral homeland through the free housing, Hebrew language classes, job training, food, clothing, shelter, help them get off to the best possible start. We want to do more, and we need your help. Please consider right now giving generously to the work of the Aliyah Return Center today. Thank you so much for joining us. We look forward to keeping you posted as to the latest developments that relate to Aliyah and return and restoration. God bless you from the land of Israel.